Okay. We have started with how to use pulse diagnosis. You use the index, middle, and ring finger to palpate the pulse at the radial artery. Imagine that the fullness you feel under each of these fingers will give you an indication about the energy status in these warmers. Under normal circumstances, these three positions should have the same fullness. There are factors that could influence them otherwise. For instance, if the patient had just eaten a full meal, the middle position would be fuller than the rest. The consumption of coffee would make the upper warmer seem stronger, but this effect would not last for long. You should not check the pulses of a patient soon after a meal. The best time would be mornings before breakfast, but this is not always possible, obviously. So after a light meal and no stimulants. Many patients are on regular medication like beta blockers, steroids, diuretics, which would influence the pulse negatively, and this cannot be helped. Example, suppose a patient comes to you with a severe stomach pain and you are convinced that the stomach yang is in excess. You try several times to sedate the stomach yang without any success. You then decide to do pulse diagnosis on the patient and come across a pulse as in the picture that you shall see later. You notice that the middle warmer is very full and the lower warmer is completely empty. Normally, the excessive stomach energy should descend to the lower warmer, and it does not seem to have happened in this case. This means you could tonify the kidney and urinary bladder on the earth point so that they will take the excess energy from earth element. This will help the full pulse to diminish and the empty pulse to improve, and the stomach pain will disappear.